Dapsone is an oral medication belonging to the class of sulfone antibiotics. It is available in tablet form for oral administration. Dapsone inhibits both antibacterial and anti-inflammatory properties and is used to treat various infections and inflammatory conditions. Indications. Dapsone is indicated for the treatment of leprosy, Hansen's disease in combination with other anti-leprosy medications. It helps to eliminate the bacteria that cause leprosy and prevent the progression of the disease. Dapsone is indicated for the treatment of dermatitis herpetiformis, a chronic skin condition characterized by intensely itchy, blistering skin lesions. It helps to reduce inflammation and suppress the immune response associated with dermatitis herpetiformis. Dapsone is used as a second-line treatment for pneumocystis jirovecii pneumonia, a severe lung infection that can occur in immunocompromised individuals. It helps to eradicate the pneumocystis organisms and alleviate respiratory symptoms. How to use. Dapsone tablets should be taken orally with a full glass of water. The tablets can be taken with or without food, but it is recommended to take them with meals to reduce the risk of gastrointestinal side effects. Do not crush, chew, or break the tablets, swallow them whole. The dosage of Dapsone tablets varies depending on the indication and the patient's age, weight, and renal function. The usual dosage for leprosy is 100 mg to 200 mg orally once daily as part of a multi-drug regimen. For dermatitis herpetiformis, the initial dosage is typically 50 mg to 300 mg daily, gradually titrated based on response and tolerance. In the treatment of PCP, the recommended dosage is 100 mg to 200 mg orally once daily for 2 to 3 weeks. Contraindications. Dapsone tablets are contraindicated in individuals with known hypersensitivity or allergy to dapsone or any components of the formulation. Glucose-6-phosphate dehydrogenase deficiency, a genetic disorder that can lead to hemolytic anemia upon exposure to oxidizing agents like dapsone. Special instructions. Prior to initiating dapsone therapy, patients should be screened for G6PD deficiency, especially in populations with a higher prevalence of the condition. Patients with G6PD deficiency should not receive dapsone due to the risk of hemolytic anemia. Patients receiving long-term dapsone therapy should undergo regular monitoring of complete blood count to detect hematologic adverse effects such as hemolytic anemia or methemoglobinemia. Side effects. Common side effects of dapsone tablets may include nausea, vomiting, headache, dizziness, rash or hypersensitivity reactions, hemolytic anemia. Less common but potentially serious side effects may include methemoglobinemia, granulocytosis, and peripheral neuropathy.